Good morning and welcome to our special March 23rd, 2020 Board of Supervisors meeting. We will call this meeting to order in open session. Supervisor Groves is on the conference line. Dr. Coons, would you lead us in the Pledge of Allegiance?
Please join me. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Consent calendar. These items include routine, non-controversial matters and will be acted upon by the board by one roll call motion. A member of the board, staff, or public may request an item to be pulled and considered separately. Item 1.1, ratify the Director of Emergency Services to a proclamation and confirm the existence of a local emergency in Trinity County due to the COVID-19 pandemic. No fiscal impact. Do we want to take these one at a time?
No, are you asking anybody to pull them, or do you want a motion on consent?
I was going to ask if we wanted to take them individually since we have OES here, if you wanted to give you a briefing prior.
Sure, I wouldn't mind that.
Ask
So I'll
if he
pull
wants to
one
pull
on
it.
one.
Yeah, you want to pull them, we can pull all of them.
Yeah, I think that'd be the best way to do it. Thank you, Liz.
Good morning, Madam Chair, members of the board. We have asked for a local emergency. This is a strategic route for us to be able to receive funding back for all of the efforts. This is in addition to the local health proclamation that we had asked for. And so that is on this item. Now, as far as an update, Marcy Kudzel, our Public Health Nursing Director, is here today and can report on a local update. And to also just give an update on our emergency operations center that is activated, as you know, and we have additionally staffed a functional area for public information officer and looking at today for planning and logistics to just broaden our outreach into the community. And so I don't have a more detailed report than that today. We are working on our public information, making sure the community is well advised. I know that presents as a challenge in our community as well because not everyone has access to the internet or is on social media. And so we will be evaluating how we can expand just community outreach in that way as well. So with that,
Good morning, Madam Chair. Good morning, Supervisors. Marcy Kudzel.
Just a second, our county council's had a difficult time logging in. Just as it's, I believe our Supervisor Groves is on, but she's having a difficult time. So there's another code I can send her real quick. I'd like to have her.
I am on, but I will say that it's almost impossible to hear Liz.
Okay. Thank you for that. Thank you for working through all these
Sit up here, Liz.
technical challenges that we hadn't had
Let's
before.
have our speaker sit over here.
Okay.
And just so you know, everything was wiped down. So.
Yes.
Good morning, Madam Chair and Supervisors. Marcy Kudzel, Public Health Nursing Director, Trinity County. I'd like to update you on what we're doing locally around COVID-19 as well as some of the changes that I'm sure have been seen through CDPH and CDC. Currently, we have 27 tests that were conducted. 20 of those are negative, 8 are still pending. Our Medical Health Operational Area Coordination Program is working with providers in our region to procure needed resources such as testing supplies and PPE, gowns, gloves, masks, face shields. We are working with Shasta County Public Lab as well as LabCorp and Quest, the 2 commercial labs that our providers are sending testing to coordinate priority of testing. When we send, if the provider states that they have a priority test, they want results back fairly soon, we get those back within about 2 days if we send it to Shasta County Public Lab. The public health lab in Shasta, though, has a triage criteria. They're only taking tier 1 tests at this time, and providers know that. We have arranged for transport of those specimens. The Public Health Department, HHS staff, we've designated personnel to transport those tests down to Shasta. The tests that go to the commercial labs, LabCorp and Quest, those take roughly 3 to 4 days to come back. However, the steps that we've taken, the county has taken, administration really helps with preventing the spread. Again, reiterating that the shelter in place is so important. As we know, Governor Newsom stated it on his press conference, and we want to reiterate that, the importance of that, and thank our populations for what they're doing. We know now, based on the science that's been coming out, that it is the potential for people to spread this illness without symptoms is still unknown, but people are testing positive and not having significant symptoms. With that information, there may need to be some adjustments in how we respond. However, again, reiterating the importance of the shelter in place, hand washing, not touching your face will really help to prevent that spread. The other thing we've come to understand, the science has borne out that it looks to be that that the droplets, the virus can survive in the droplets on surfaces. The science bears out plastics, metal, roughly up to 6 hours. It'll survive on those surfaces. Cardboard, about 45 minutes, and that's all we know right now. With that said, again, wiping down surfaces, if possible, before you come into contact with them is always helpful. I've seen our population wiping down grocery carts before they touch them. That's brilliant, exactly spot on. And again, reiterating that no matter the surface, if we practice good hand washing and practice not touching our eyes, nose, mouth, that would go a long way to also help prevent the spread. I am here to answer any questions you might have. Any questions? Go ahead.
Is there any concern about contamination of money and stuff like that? Is that an issue?
You know, Supervisor Brown, we don't know that yet. The closest the science is borne out is cardboard, 45 minutes. So we don't know how long it lasts on paper. The virus is sustained in a liquid droplet. So we know that masks can absorb liquid. That's one of the reasons why it creates a barrier. We don't know how long the virus will survive on a paper environment beyond that. And I don't know when that information will come out. So we recommend, again, good hand washing and not touching your face. That's about the best we can do for prevention right now.
Supervisor.
Thank you, and thank all of you for your updates. Your YouTube stuff was great. Thank you. I'm watching something over the weekend start to develop throughout our state and Oregon, and where people think stay at home means go on vacation. And we're seeing impacts to Joshua Tree, Laguna Beach. Marin just shut down all their parks and beaches. State of Oregon has issued a similar thing, stay away. So do you get the sense that CDBPH will issue a reminder that shelter in place means to really stay home, stay local? Certainly for the gateway communities to public lands or small communities, we can't absorb impact if something was to go south, obviously, with our medical system here or any other small community. Do you see anything developing out of that of concern at the state level?
Thank you, Supervisor Morris. I think that our environmental health director could probably speak to that, dealing with those environmental concerns. A lot, CDPH and CDC will provide the guidance. Of course, the governor provides the executive order, and then local jurisdictions decide how to manage to that. in collaboration with their health officer. So I don't know if that answered your question, but I think we can engage in those discussions to see what that looks like for our county.
Or even just remind folks, I mean, I looked at the executive order, it doesn't say go on vacation, it says shelter in place. And I don't know if people, some folks, not our county, everyone's doing great here, missed that memo, just stay home and stay local. You can walk your dog, go for a walk in your own back area, neighborhood. So I don't know if we just need to emphasize that message, which already is out there and given to us from the state. So just wanted it on your radar.
Thank you, Supervisor Morris. We are working with our Office of Emergency Services, and what occurs is those with the expertise in a specific area funnel that information to our Office of Emergency Services and the PIO, and we coordinate that messaging along with our health officer to ensure that we're providing most up-to-date information to our populations on how to protect themselves and our communities.
Great, thank you.
This is Keith. I also want to point out that we're seeing a pretty good influx of our second homes, people coming here. I would say maybe 20 or 30% of our second homes now have people that have fled the Bay Area or, wherever. So that's something that we're going to have to take in consideration.
Thank you, Supervisor Gross. That's important to know.
I'm sorry, one other unrelated question, if I may. So, and maybe this is a question for Daryl, but hopefully we never have to cross this bridge and that our county will remain safe and healthy. But if something does change, I understand we don't have an ICU bed here in our county. Is that correct?
So Supervisor Morris, at any given time, we have a system that we look at called EM Resource that is a regional resource. We are able to see at any given point in time the bed status of the hospitals in our region. That's really important as we take care of the ill and make sure that our healthcare system is able to take care of those that are not infected with COVID or any other illness, but able to obtain whatever healthcare they need. I hope that answers some of that question, because at any given time, I went through the bad flu season in the 90s. I was working in a rural emergency room, and we were inundated in the ER with flu patients. Our hospital was full, and we could not find a bed to transport a critically ill person any closer than Fresno. This was from Calaveras County. So we do have precedent that has built this system in a way that is able to respond to that. So we're in constant communication with our healthcare providers, with our region, with our state around the bed status, what beds are available, what hospitals are able to take patients into their ER and admit them. And I hope I answered that question.
Yeah, thank you.
Okay, was there anybody else? Did you want to report out?
Yep.
Please come on up.
Good morning. So I just wanted to give you an update on kind of how we've been all working together. So we did notice after the shelter in place order.
Can you get her on a mic so somebody outside can hear her?
And go ahead and state who you are and what we all know you.
Sorry about that. Christy Anderson, Director of Environmental Health for Trinity County. I wanted to give you an update on how environmental health has been proceeding. Now, we did notice after the shelter-in-place order and the advisories placed by the governor that we did not have bars closing and we did not have food facilities restricting to takeout and delivery. So on Friday, we did work with the health officer to make that mandatory, and that was issued in a press release. This morning, we are sending out letters to each food facility as well, because I did have to call a couple of bars this weekend and notify them directly. That has been of some concern. We're also going to release a guidance document for crowds over 6 people. People that don't share a household together should not be meeting, gathering, going on vacation, things like that. So we will have a guidance document that will address gyms and things like that. And I we're just trying to really stay on top of this, so anything else that I can provide you as far as information, I'm happy to.
So where would the public find the information?
The information has been in our press release through OES, and that was done on Friday afternoon. And then also, I believe it's posted to the website, trinitycounty.org. And then we also are directly sending notifications in different language to the food facilities and bars so that they have it in hand.
So Christy, this is Keith. I just wanted to clarify, it was a little fuzzy. On Friday, you made a mandatory to shut down of bars and restaurants.
That is correct.
Except for takeout.
Except for takeout and delivery.
Okay, thank you.
For the restaurants.
Yeah, for the restaurants. We really want to make that available to the public that needs it, but we also realize that everybody drinking in the bar, close proximity, glasses being shared, not a good idea.
And then you might want to, I don't know, send something to the resorts who are recruiting people to come here, was another thing that was brought to my attention.
And our resorts did receive the same mailing, but we
Okay.
will emphasize that.
Okay, thank you.
No problem.
I mean, I understand the need and reason,
Yeah.
but
Are resorts mandatory to shut down, or just the food service and the bars?
The food service to be restricted and the bars to be shut down. However, we can address the fact of tourism, if that is a concern. I would have to speak with our health officer and make sure that's the correct route, but it is something that I've been addressed a few times now.
I mean, I understand when they have reservations already, but there was over the weekend a call out for people outside of in the state to come here. And I get reservations already made. I don't really have an issue with that, but trying to recruit people here, I get a little nervous, as did the public.
It's good to know. It helps me adjust how we're doing things. Yeah.
Thank you.
Well, I will point out that many of the resorts in my area have reservations a year in advance, so that's just information for you to deal with.
Yeah, and Keith, you know, if you were sitting here, and again, I think that's understandable, but there was a plea for folks to come here, come recreate with us, and that was making people nervous.
So should we talk to the chamber about that, or?
Or maybe Christy.
I can reach out to the chamber and discuss how they're approaching tourism, for sure.
And we don't know if this was a scheduled recruitment or advertisement planned in advance. And
Oh, it wasn't, judging by the language they were using.
Okay, that's right.
No.
Thank you. Mr. Presley, did you want to report out on anything?
Well,
Please sit.
Jump over this weekend. Yeah, get closer to everybody. Yeah.
yes. So I don't have anything specific, but what I would like to do is make sure that the public does know, they are aware that if they have any other avenues which they think would be effective for us to reach them, to just let us know. Because that's what we are trying to do. So if we have a population of anywhere that believes that we need to be maybe printing out flyers and bringing to their general store or whatever, to just let us know, because we want to keep everybody informed and we don't want to miss any of the possibilities here so that people go uninformed. But that was basically it. If anybody has any questions.
No, I just would emphasize that I know Mr. England with the food bank is planning to deliver April and May's. And I think any flyers that any department has, I would really encourage to get them to him soon, and that he could put them in the boxes and show those, because he reaches a lot of the outlying communities that do not have telephone or any type of internet. So he's a wonderful resource, and I know he's working really hard. So if you don't have his contact, I'd be happy to share it with you.
I've been in contact with him multiple times, just over the weekend even, so I guess we're aware. Thank you.
And so the default is certainly everything gets posted to our homepage of the county website, right?
Yes, ma'am. Everything, the OES website, the HHS website, and the county main page are all linked. So the one thing goes to the main page, it goes to the other two as well.
Great.
Copy.
Ed, this is Keith. I am a little concerned on our second home people that don't read the newspaper, that don't know anything about our county except come here and have fun. So if anybody has ideas how to get information to them or in a place that they might be, that'd be great.
In Hayfork area, we have our local billboards at the Frontier Fuel as well as the stores and maybe at the county. So perhaps we could put local flyers. Supervisor Finley?
Code red,
So it's like,
Code red.
code red, reversing on 11. Just an announcement since we don't have 211 service.
that's why I said it's code red, could at least tell them where to find the information, because it does hit every phone that comes into our county, doesn't it?
Yeah, the iPads option.
Yeah, so we could do that and just let them know that, please view these websites to find information regarding COVID-19.
And still put the flyers up for the out-of-towners who don't have the code red yet. And Supervisor Brown and then Supervisor Morris both have questions.
I was just wondering about if there's been discussion about food supply to the county. I heard that holiday is wiped out and stuff like that. So is there a bigger picture concern or plan as far as food logistics?
So, in working with Jeff over the weekend, he has procured about 3,000 extra meals that's going to be stored in a warehouse here locally. In talking with, because my wife does work a holiday now, in talking with her and talking with Jeff, the manager there, they do plan on continuing getting shipments, but it is going to be a hit or miss as to what they actually get. And I have heard a little bit, maybe a little bit disconcerting about the priority that he'll be giving the larger counties, priority over bringing the food out here to Trinity County. So if that does become an issue, I'm going to address that personally with Shasta County so that we can all stay on the same sheet as far as getting commodities and everything continue to be sent out here.
Yeah, I heard that was an issue in Willow Creek with UNFI food distribution, and they told the natural food store there that they would be limited because of the rural logistics. Would you advise anyone to go out of county to get groceries if they're concerned or anything like that?
Well, I would advise if someone is in need of food, that they just follow their normal channels, because right now I don't know that they don't have food at Holiday, at Wiley's. I haven't received any information that says they're not going to get any more food or there's going to be such a food shortage that it's going to cause a problem. So I would advise them just to follow their normal channels. Just to remember, if they do go to Winco or Costco in Reading, just remember that it is that still same 6 feet of distancing. Just be aware of that kind of stuff. But if I did get word, or if we did get word that there were going to be actual shortages and we weren't going to be able to feed our people, then we would have to step up, and I would go to either the region or the state.
Two questions on follow up on Supervisor Brown. Over the weekend, a lot of our stores were getting, the grocery stores of course, were getting really wiped out. I had staff tell me people were coming up to shop, and so I don't know if there's something we can have a conversation again with the holiday management, limiting people. I don't know. I mean, the shelves were bare pretty much. A lot of local people were very frustrated they couldn't do their shopping. And a lot of our people can't go to Reading. A lot of our seniors, very limited income, cannot go to Reading to pick up supplies, so that could be on everyone's radar. And back to communication, do you think it might be wise to, especially maybe at Dollar and Holiday and the stores in Hayfork, have the billboards like we do with flyers? That way people are coming in and out, they can check your billboard if there's an update for information.
Okay. Yeah, I mean, that's good. We're open to anything.
And the post office.
Oh, yeah.
I will chime in.
I'm done.
So I had an opportunity to speak with one of the louder.
So a public comment that came in just was that information could be put in the power bills.
I'm sure.
So
Right.
this is just a place to get information out.
Great idea.
Thank you. That's a good idea. Power bills. Goes to everybody. So one of our local stores in Hayfork is opening to the seniors at a specific time and only allowing the seniors. And at this time, they're not prohibiting amounts or quantities like some of the other stores, but there has been an increase in out-of-town. One of our local stores on Friday received 8 or 9 calls from people out of area. One gentleman came as far as Yuba City. So we are seeing that in the Hayfork Valley right now with a lot of out-of-town people because we have not, many of the residents of Trinity County, we have lived through so many fires and power outages that we know how to ration ourselves, but it's the out-of-towners that do not seem to live by the same concern. So I don't know how to address that. I did meet with a store owner over the weekend and trying to wrap our mind around having perhaps a shop local ID preference, but then there's all kinds of problems with that. So I don't know how to address that. So any suggestions I'd be happy to take back to the Hayfork side.
Well, I mean, the way that I understand that is, people need to only take what they can use. And, when we were abroad in the military, you would have rationing in different places. And if it gets down to it and store owners see somebody coming in and buying, 30 pieces, containers of toilet paper or, 15 gallons of milk, then I do think that they should start thinking about watching the amount that the people are purchasing like that. And people just need to be reminded, and that's something that we can send out a little press release on. Just buy what you're going to need. Don't act like the world's going to end because it's not. Just get what you normally get there. And, don't act like you got a stockpile because you can still go out and buy groceries anytime you want. And milk usually has a shelf life anyway, so it doesn't, and this could go on. So, we just gotta
And again, I
prepare.
think I don't see our people
It's not okay.
reacting that way. It's those who are coming up trying to stockpile out of our inventory. And that is making people very nervous locally.
Right. Well, I think if we start sending these notices out to the people so that they get that message too when they do come up here for their 6 months or whatever out of the year, I think that will help. Getting it on the boards in front of the stores so that if they're not used to shopping here, maybe they don't think like that. And then when they start seeing the notices, maybe that'll start helping them understand a little bit better.
Yeah, it's people making a day trip from Reading is what staff has told me at various stores and restaurants last week, so. Or,
Let's reach out to our lobby groups, CSAC, RCRC, see if other counties are having similar problems, concerns, and possibly address at that level with the supervisors and the other CAOs.
yeah, I've sent a
Your
note.
comrades out there.
That's a good idea.
I've sent a note to CSAC, and they are very involved in this whole issue.
They are,
overall.
yes. I get their emails.
Yeah.
Okay, so thank you very much. Thank you all for being here. Shelley, do you have anything?
Just for the next.
Okay, but I didn't know if you could, just for,
Oh, no, I was just going to relay what Daryl had as a public comment, which was, perhaps notifying the public via their utility bills, if utility companies would add that in their billing.
that would be a great idea. For those on the phone, Shelley Nelson, HR, was just encouraging the public comment of adding it to the public utility bills, the information, the bills. So bringing it back to the board.
I move to approve 1.1.
Second.
Supervisor Finley?
Yes.
Supervisor Morris?
Yes.
Supervisor Brown?
Yes.
Supervisor Groves?
Yes.
Supervisor Howard?
Aye. Thank you. Item 1.2, Human Resources, adopt a resolution which revises the interim personnel policy regarding COVID-19 coronavirus. No discussion. Yes, please.
Good morning, Shelley Nelson, Human Resources Director. So the COVID-19 interim personnel policy we had brought to you at the last board meeting, and I just wanted to bring this back to you. This is a living document. We would be modifying it from time to time to make modifications or clarifications, which would allow the departments and employees to understand the implementation. I thought what I would do is just highlight those areas that we're modifying for clarification. Our understanding is the Trinity County Office of Education has issued a listing of current school closures within Trinity County, which was different a few weeks ago. And all employees of the County of Trinity now are considered essential and therefore expected to continue to provide services to the public as assigned by administration, human resources, and/or their department heads, unless they meet one or more of the 4 COVID-19 reasons that we had stated above. And I want to note that on the resolution there is a typo. It should say unless they meet instead of unless the meet. So I'll make that correction. Employees who need to shelter in place for one or more of the 4 COVID-19 reasons stated above. You want me to emphasize what those are again?
If you could, please.
Okay. A, the employee has a current diagnosis of COVID-19. B, the employee is quarantined, including self-imposed quarantine, at the instruction of a healthcare provider, employer, or government official to prevent the spread of COVID-19. This includes those employees self-quarantined due to age and/or pre-existing medical conditions, placing them in the high-risk category. C, the employee is caring for another person who has COVID-19 or who is under a quarantine related to COVID-19. And D, the employee is caring for a child or other individual who is unable to care for themselves due to the COVID-19 related closing of their school, child care facility, or other care program. Employees who need to shelter in place for one or more of the 4 COVID-19 reasons stated can effectively perform the essential functions of their classification while working remotely from home, shall do so at the direction of their department head unless they are suffering from symptoms of the disease. Employees who need to shelter in place for one or more of the 4 COVID-19 reasons and cannot effectively perform the essential functions of their classification while working remotely from home shall be entitled to the use of emergency leave up to 80 hours based on the provisions of the newly adopted Families First Coronavirus Response Act. And upon expiration of those hours, they shall be allowed to use any leave available to them during the necessary period. The next item is employees who have minor children who are unable to attend school or daycare due to illness, quarantine, or school daycare closures due to COVID-19 and who cannot find other child care arrangements and can effectively perform the essential functions of their classification while working remotely from home shall do so at the direction of their department head. If the employee is unable to work from home or not directed to do so, they shall be entitled to use the use of emergency leave up to 80 hours based on the provisions of the Families First Coronavirus Response Act. Upon expiration of those hours, they shall be allowed to use any leave available to them during the necessary period. We skip down to 6, which is new. During the existence of a declared local health emergency related to COVID-19, employees may be temporarily reassigned to another department to ensure that essential services are being provided to the public. These reassignments will be requested by departments and approved, assigned through Human Resources and Administration. On 7, this is new, and I do have copies of this policy. I failed to attach it to this agenda item, but it is on the Human Resources website, so if you'd like a copy, I can give it to you. But we have a vacation compensatory time off donation program policy already in effect. During the existence of a declared local health emergency related to COVID-19, we're proposing it be enhanced to allow employees to also donate sick leave. As of right now, the policy only allows vacation and compensatory time. Employees may also request leave from the bank for COVID-19 related reasons as listed on this interim personnel policy. And if requesting time from the bank for one or more of the 4 COVID-19 related reasons listed on this policy, Section 1 of the Vacation Comp Time Off Donation Program are waived. And I'll emphasize that Section 1 states that you must have a serious illness longer than 4 weeks. But if you're one of the 4 COVID-19 listed on the policy, we would waive that 4-week period. That's what we're proposing. And then any other modifications? Nope, that would be it.
Supervisor Cooley.
It was answered.
Okay, thank you.
Or it doesn't.
No questions from the board? Keith, do you have any, Supervisor Groves, do you have any questions?
I do not.
Okay. Nobody on the
All right.
public?
I move to approve.
Second.
Supervisor Finley?
Aye.
Supervisor Morris?
Yes.
Supervisor Grove?
Yes.
Supervisor Brown?
Aye.
Supervisor Chowder?
Aye.
Thank you.
Thank you. So this concludes our special meeting of the Board of Supervisors. The board hopes you all safety and be wise, and we thank you for your consistent work on behalf of Trinity County. Thank you.